Testing.
Hello?
Of course, the annual service calendar is always included in our presentation.
Okay, we have here the financial monitoring report. But these are the PMPMs through the end of the plan year. Any question? 228. The Humana cost. Okay. This with Humana, and I realize that yes, I just broke this out because these are classes. This is actives, retirees, and the retirees plus 65. When I added this plan here, I assumed that there would be a question about what the Medicare Part D cost was, and so I just put it on here to be able to break that out. I realize it's added more confusion. Okay.
Does that help you, Ms. Bedford? Well, services, etc., per member per month.
Also inclusive in this, so that's offset.
Yeah.
Gotcha.
That has to
the
be
school
paid.
would pay on behalf of, like,
Yeah.
that's correct.
Yes, but the
50% of the active or whatever.
Yep.
Or
But the premiums are also each year based off of how that plan is running, right? And then they issue that fully insured rate, basically.
Gotcha. Thank you.
This has been included just to show why these numbers sometimes look different each month. The variance just was. This does not vary as much in my mind, but I know it might look like to some. I see, we have these months where you see 711 here and 631. What happens is this is a cumulative, so as we get closer here, these start to level out. And this is just to illustrate because we get rebates as well as subsidies at certain times a year to offset that. All right, and
Okay, we can go to the next slide. To create some savings opportunities to the plans. And then below that, you'll see the 2026 initiatives that will go live 1/1/26. Just know that these numbers were estimated savings dollars, some from vendors, right? Some from us doing certain analyses and things of that nature. After 1/1/25, we're gonna go back. I have to do it in about first quarter of 26. So we have enough information throughout this plan year to be able to validate those savings, right? And see, did we meet the mark? Did we meet ROIs, or did the vendors meet ROIs and things of that nature? So that analysis has to be done in the first quarter following that year of implementation. And then we'll do the same thing for 2026. In first quarter of 2027, we'll do our analyses to validate what those vendors stated they can save you guys, okay? Any questions on this?
Yeah, I have a question. So at the bottom of this sheet, where it says RX plan, year one, the total is 7 million. Is that what I'm
the 3-year cumulative is 7 million.
7 million, yes.
Yep. For 3 years cumulative, but for year one, it's 2.3 million.
And that's for the commercial PBM. And then the second line item is for the EGWIP PBM.
So between the two of them, there's going to be a $4 million
That's correct. In year one.
in year one.
Year one. 4 million in year one. Yes.
But year one, between the two, 4.3 million.
Yes.
Okay.
I'm sorry. Okay, excuse me. Year one, sorry, thank you. 1.4 and 2, so 3.4.
3.4 million. Sorry.
So it's $3.4 million.
That's correct with the change.
Build a wing.
And those are usually you end up exceeding those savings on the pharmacy side. is just a recap of the point solutions that we've put in place since 2025. The first one being the Lantern, which is basically an MSK surgical center of excellence program. We implemented this 3/1/25. They needed a longer roadway to actually implement this program. 2 procedures have since March been completed under that program. We do receive data from the vendors, but again, we like to validate what they're showing us after a full year's better ways in which we can, in order to drive more engagement. Because again, that is a voluntary program. That is the chronic condition management program that focuses on pharmacy. That was implemented 1/1/25. There's been 182 total members engaged since through July, since we implemented this in 1/1/25. 106 actives and 76 retirees. These engagements involve diabetes monitoring, blood pressure monitoring, pharmacist interventions, basically looking at someone's drugs that they're taking and possibly making recommendations to not take something or to take something else, things of that nature. Quantify is a fully integrated infusion solution. They're actually a provider, they're not a vendor. So they're almost like a center of excellence type of infusion provider. This is where they do those infusions in the home, which of course is usually better for the patient and the member, and creates savings to the plan as well. This will apply to both actives and retirees on the self-funded plan. They can take advantage of it. They have already worked with the new TPA, Maritime, as well as the PBMs to get integrated there, because they do have to be integrated with the company that processes your claims and things of that nature. So we've already been in the works with them going through implementation. And then FedLogic as well. It applies to actives and retirees on the self-funded plan. This is the program that helps your members tap into over 800 federal and state programs out there that either can potentially help with cancer, premature babies, really anything you can think of, high cost claims, things of that nature, to try to help someone possibly either tap into a resource that would help with their out-of-pocket costs, or that particular procedure would run through another program as opposed to yours, or it can potentially find a program that's better for them to be on for that particular situation that they're in. So we're in the works through that implementation as well.
So remind me on that.
Yep.
Is this something that we as a district or you as a consultant are going to be working to identify potential within the group, or is this our group going to have to be educated on it and then seek it?
They're going to have to be educated on it and seek it, because it's technically illegal to incentivize folks to jump on a number of these programs. So it is a voluntary program. However, the FedLogic comes up with different types of strategies for people to identify where they might need a program, or that a program's out there. So we're going to have surveys that get sent out as well, where you complete a questionnaire, and it basically at the end of that questionnaire would say, you probably would be a good fit to call because of X, Y, and Z. And so even someone that might feel like they're healthy or there might not be a program out there, it helps that person actually say, maybe I should. So there's different communications outside of just sending a flyer that we're working through on how we can help members understand that this program could potentially help all members, right? Outside of just their own health condition and things of that nature. Okay, so I just wanted to provide you guys with an update on where we are. Of course, moving to a new TPA and PBMs is a huge undertaking. in the background. So from the day that you guys voted and passed those votes to move forward with these changes, we've actually been working with those vendors and behind the scenes and getting everything up and running so we can ensure a smooth transition. So just as a recap, we're moving from Louisiana Blue to Meritain, Aetna, Verity, and direct contracting effective 1/1/26. Our implementation, we have weekly reoccurring meetings with Lafayette administration, Gallagher, and Meritain, so we can ensure minimal disruption. We're also working with direct contracts and trying to secure those for those quote-unquote disruptors or those providers that weren't in either of those networks. We've had discussions during implementation. We walked through these items that are listed up here. So initial discovery, setup, eligibility, account structure, enrollment, open enrollment, retirees, and Medicare, and how we're gonna get the folks set up, because not all TPAs are exactly the same, right? Some have some systems that have to do things a certain way. And so working with them on plan documents, plan coverages, how COBRA would be transition of care and timing, things of that nature, to ensure that we have everything up and running for open enrollment and to kick off on 1/26, so it's very smooth. I wanted to give a high level touch on the network directory. I understand, that we're working with Meritain, which is going to have Aetna as the network, and then we have Verity as well. So Meritain does have the ability to add the Verity link to the Meritain member portal. So once your members get their ID numbers and things of that nature and set up an account, they'll be able to log in, and they'll have 2 spots right there when they click on Find a Provider to be able to look in those areas. We're working with Meritain and Verity on how we can get the direct contracts also set up there, whether it's going to be a link or a listing that's regularly monitored and updated of those direct contracts. We're working through that with IT and how they can help assist in that space. So we had conversations last week. I will continue to have conversations. I believe they're going to have a solution by this week, so we'll know definitively how your members will be able to view those direct contracts that they'll be able to secure. Open enrollment is set for 9/22 through 10/24. We've, again, like I stated earlier, we've engaged with our Gallagher communications department. They're all skilled in what they do and have the data, and then that way we can track everything that they put together on how do we need to approach communications and education to your members in a better light. What type of questions are they getting? What's beneficial? What's being communicated effectively? So we've engaged with them with a lot of materials to be able to highlight all the programs that you offer to your members, because in yesteryear it's kind of been disjointed, right? And so we're trying to pull it all together, a one-stop shop for your members to see all of those added solutions that you have available to them. Meritain and Verity provided provider letters for members in order to assist members on the networks. I think isn't in one of the networks. We do have a letter for them. That way they can give that to their provider and work with Verity now and Meritain. Everything, though, they are working to secure those providers in their networks as well, outside of what's being worked on from a direct contract standpoint. But it's just another layer that we're trying to add onto all of this to try to get as many of these providers in y'all's network as possible. And then direction to members, providers to connect with Lafayette Insurance if they need assistance with their provider not being in the network. We've set that up. And so the Lafayette administration can help direct them on where to go, who to speak to, and things of that nature. So we've got that in place as well.
So I think one thing worth noting, you mentioned earlier, or several times, that Meritain Dairy, you guys accused, everybody's working toward that disruption gap, but I can't wait till next month. I'm very, very
Yes.
hopeful that it's going to be here, because not only are they closing the gap, but there are some providers who were already in the Meritain network that are actually renegotiating the contracts with us. You heard that right.
That's
You heard that right. That is going to be such a unbelievable potential. I'm excited. I can't wait. Hopefully, no, not hopefully. Next month, we're going to be hearing about that.
Yes, yes, and that is on our pipeline and agenda, is to have those top disruptors or providers and show you guys where they were before when we first did the analysis and where they're sitting now. So that will be shown next month.
And let me just add to what Mr. Hidalgo just stated, that in several of the conversations that we've been having with these different providers, and I want everyone to kind of just listen to this, that they are amazed that what we are doing right here is exactly what they are reading books on, or what exactly is taking place throughout this country. And direct negotiations with certain providers, with the company, this TPA that allows us to do this, it means that we're going to be able to look at some cost savings that we're not going to have to worry about year in and year out, asking our CFO if we need more money from the general fund account. We have to be able to do this, and I'm going to tell you, Mr. Hidalgo is right. We are on the way, and we're going to surprise a lot of people, and a lot of people are going to be shocked about what we actually heard from these different providers, of which they're able to do for us, because we have bargaining power, and it's showed with some of these big people that we are talking to.
Absolutely. Okay, and this slide just highlights, where we are on the PBM implementations as well. For the non-65 Medicare eligible folks, we're moving to Optum. We had a discovery call and implementation kicked off on August 11, 2025. We have weekly reoccurring meetings with Lafayette, Gallagher Pharmacy Team, and Optum. We basically are walking through the same types of discussions, files, data that I stated before on the TPA side, to get everything connected and up and running. Communications have been set up between Optum and Meritain, so their constant coupon program will be implementing come 1/1/26 a program that's very similar to that. Members will have combined medical and pharmacy ID cards. With the MedImpact Edgewood PBM, pretty similar story. Get administration to file extra communications with health Aetna ID card. Members will have a
I spoke to Mr. Edmund has been receiving questions and calls about easing that mind.
it works when you transition either PBMs or Meritain. And every week we have to get on an hour. So we just finished a lot of it will be and start paying attention to that sooner rather than later. So we're working towards that. And this is just the service calendar. Again, remember it's fluid. Sometimes I have to change meetings and things of that nature based on us rescheduling meetings like this one today and things of that nature. But this just kind of keeps us on track internally. As things change, I'll update it.
Moving to item 2.3, discussion and action regarding the staff report. Ms. LaBeouf, come on down.
Hello everyone, good afternoon. Let me just get my slide deck up, please. Okay, it's been a bit since I've been able to report to you. Several things have happened within the insurance department to which we have been sending communications along the way. But I just wanted to remind you of a few of the things that have occurred and things to look forward to for next year, January 1st, 2026. So today we're going to be discussing Emeritus Dental. We're going to review open enrollment, which we're on the cusp of. And we're going to just reiterate the vesting policy changes that occurred with policy EGA that the board approved just in July of this year. I want to reiterate that because it's very important for the open enrollment period to give direction to employees. So with that, the Emeritus Dental will be receiving an increase for both active and retired members. There was a benefit renewal effective for January 1st of 26. An RFP was completed. As you can see there, 22 companies were solicited, 17 declined, and 5 quoted. Those who did quote proposed a rate increase of 35 to 55%. We are assessing a total of 3,076 plan members. Based on current increased claims and utilization during plan year 24 and 25, you can see the current rate right there at 112% loss ratio. Meritain has come back with an increase for effective January 1st. Their premium increase is 32 to 33% depending on the population between the active and retired member. Emeritus Dental was the lowest provider. They did offer a 2-year rate guarantee to include 2 value-added benefits between the LASIK sound care hearing benefits. And Emeritus Dental pays at the 95 of reasonable and customary charges. So what can members expect? During the annual open enrollment period, they do have a choice. Active members in particular can connect with AGM and Hub. They can make changes to their dental plan. Perhaps they want to change from the high plan to the low plan during that time period, because all memberships between the active and the retirees will see a rate increase. Active members will see that rate increase to their January payroll. Retirees will either see an update to the January TRSL pension deduction, or perhaps if they're being deducted through bank draft, they'll see it through their ACH, through their bank account. Members are going to receive ongoing communications. I'm on the cusp of sending out communications to both active and retired members. They should see that on the 19th of September. I'm going to front load it and send the whole open enrollment packet that talks about all the various changes for open enrollment. They will see information within that packet, in particular with Emeritus Dental. To include retirees, will be receiving a paper mail out that will have the letter that is listed within the open enrollment packet that we will be communicating. So I just wanted to make sure members are aware that they will see an increase to their January deductions for their dental premiums. Any questions?
Yes, when is the last time we looked at self-insured?
So when they did assess self-insured, and the loss ratio is too much to look at that option as a possibility. It's not going to benefit the district for a self-funding option under dental, but that was duly assessed during that RFP process.
Trish, just one more question on the numbers. So it says 22 solicited, 17 declined. Is that common to have that many people decline to quote?
So keep in mind, we do have active and retired populations that they're assessing. So in addition to that, they also have to be able to deduct the premium from the pension. There's very few providers that can complete that task for retirees in particular.
All right, thanks.
So Dina Dental was
everybody should be able to want to quote.
right. The other catch with that is that our loss ratio is high.
Gotcha.
So some of the providers did not want to present a quote.
Okay, that makes sense. Thanks.
Any other questions on dental? So I just wanted to pause for a moment so you can see what that 32 to 33% actually looks like. So the table on the left with the blue, there is a high and a low plan with the current dental rates. That's what we're currently running under if the member has dental. The chart on the right, the all gray chart, is what that increase will look like at a 32 or 33%.
When self-insurance was considered, was it simply apples to apples, or do we consider anything such as plan changes, steerage, or anything, or it was just apples?
The RFP was done back in April, but yes, I believe they looked at it an apples to apples scenario, currently what we have now to what we would have then. Keep in mind, you do have retired members under your dental too, which does have an effect on your reviews under an RFP process. Because of the utilization by the retired members as well. So it's your population, because we have active members who are currently employed and retirees who leave the district are still eligible to keep that dental insurance post-retirement. Not every district offers that scenario. Some of them say once you retire, you're not eligible to keep the benefit. The LPSS does have membership under both, which when you review claims and billing, it does have an effect.
What would happen if they were separated? Not eliminated, but separated?
We did look at that. It would drive the retiree premiums up even more than what you're currently seeing here, which would have a negative effect on your members. So we do have, keep in mind, we have another retiree closed group of members. There's a total of 330 in that group. Let me back it out. When we transitioned from Dina Dental, that claim was not an offering under our next provider, which was Aflac. They closed that group off, and now there's just a set number of members in it, and that's the closed group that you're seeing there. So when communications go out to retirees in particular, it will designate which group that retiree falls into. It's either going to state the premium for the current retiree group that I just noted a moment ago, or if they are in the grandfather group, it will also have those premiums listed. But all retirees will receive a paper mail out in the mail. It's due to ship on October 1st. But they will receive my packet electronically and via text message on the 19th of September.
Okay, one second. This is an IT question. I don't know if he's listening back there. Oh, right there. Why do our screens keep blinking on and off? It is completely distracting.
Whole system's down right now.
Okay. Can you turn these off?
With unplug your screen.
That's fine, thank you.
Yeah, I mean, mine's everywhere, so you might want to check mine.
Go ahead.
Okay, so we are literally on the cusp of open enrollment. As a reminder, open enrollment is the period in which the member has the opportunity to make benefit changes with Lafayette Parish school system. There are a lot of changes occurring for January 1st of 2026, as we just heard from Gallagher. So I'm getting ready to communicate with all members, to include active and retired members. We are going to communicate text message, phone, email. We're going to send postcards to try and make sure that everyone is in the know that this is their opportunity to make benefit changes. We're also going to be communicating with regard to the January 1st changes with the medical and the pharmacy providers that we just discussed a moment ago with Gallagher. But if we'll focus on the active employees on the left first, keep in mind it's a passive open enrollment, which basically means that if the member does not make a change to any of their benefits roll over to January 1st of the following year. That includes your group health insurance and your voluntary benefits. Now we are transitioning from Blue Cross Blue Shield to Meritain Aetna. The member does not have to do anything during this transition. We're gonna take care of all of that for them. We're gonna make sure that they receive their new ID cards and everything is in place so that they have medical and pharmacy services. I mentioned a moment ago the types of communications that are gonna go out. Numerous forms of touch points to make sure that members are aware that it is the open enrollment period, and it's important to connect with us should you need to make benefit changes. Voluntary benefits are administered by AGM and Hub. There are 3 options to make changes during the open enrollment period. There is the self-enrollment online. Member goes online, I'm gonna send a direct link and give instructions how members can do it if they prefer to just take care of the process online and make changes to their benefits. There's also a call center. Maybe the member wants to call and talk through these changes for January. Or every single district location will be receiving in-person consultants from AGM and Hub that will be on property. Within the packet that I sent out to active members, it will list the dates that they will be at your particular location. So a larger school may be on property for 2 or 3 days, whereas a smaller school, they may only be on property for a day. But please connect to send emails to the district work email address. Please make sure you're checking your work email address. Just a reminder, we mentioned it a moment ago, Meritain Aetna will be the new provider, Meritain Aetna, including the Verity Network, to include those direct contracts that we're working through. That will be the provider change from Blue Cross to Meritain Aetna and Verity effective January 1st. And the pharmacy benefits manager that will change on January 1st is OptumRx. So we're going from RX benefits to OptumRx for non-Medicare active members. So the retirees, we're going to be communicating with them too. Lots of communications. I'm going to try and give it out in segments that will allow the member to take a look at the information, read through it, perhaps connect with us if they have questions. That way we can point them in the right direction. But it's a passive open enrollment for our retirees as well. So again, if the member does absolutely nothing, the benefit rolls over to the next plan year. That includes the group health insurance with Meritain Aetna, including the Verity Network, and our Humana Medicare Advantage members. So all of it will roll over if the member does absolutely nothing. That just lists the forms of communications. Again, we're just wanting to make sure that our message gets out and that a retiree is not thinking that they still have Blue Cross on January 1st, because they will not. We are providing a wonderful educational workshop come this Wednesday at the district office boardroom. Meritain Aetna, the new provider for health insurance, we're offering a morning and an afternoon session. It will be the exact same educational opportunity. We'll be covering the exact same materials. We just wanted to provide 2 opportunities for members to come. That also includes the group health insurance Medicare Advantage plan. If you're interested in learning more ahead of open enrollment, perhaps you want to make a change, there is again a morning and afternoon session. Both sessions will be the same. And IT has been gracious enough to assist us again. I am going to be taping the afternoon sessions to make sure that I send it out in emails to both active and retired members to come to the district office. Again, transitioning from Blue Cross to Meritain. Now the pharmacy benefits manager changes for Med Impact, which will be administered by Vibrant RX for our Medicare members. So retirees, when they receive communications in the mail, please pay attention to, it's going to note Med Impact administered by Vibrant RX. So please don't discard the communication if you happen to see Vibrant, because that is your new provider. Any questions on this piece? So vesting for group health insurance, the board approved this through board policy EGA. It is going to be extremely important that members pay attention to our new vesting criteria. If, my biggest question that I would ask members is, are you retiring from the district in the next 5 years? If your answer is yes to me, then I need them to pay attention to my communications. Because now, the member has to be on our group health insurance either effective January 1st, or they have to vest into the process. They're required to be on our group health in order to be eligible for them and their dependents to have group health insurance after leaving the district. So one of two ways they can do this is if they're not on our insurance now and they are planning on retiring with the district in the next 5 years, then they need to connect with us during the open enrollment period and they need to enroll. If they enroll during the annual open enrollment period, they would be effective January 1st, and they would be considered what's called grandfathered, meaning they don't have to vest 5 consecutive years. We're going to give them a pass, is how I would describe it. If the member is perhaps greater than 5 years from retirement, then perhaps they can wait. They can assess their needs. They can take a look at whether they are wanting group health insurance when they leave the district or not, and then they can enroll at a later date, but they just need to ensure that they are required now to vest 5 consecutive years immediately prior to their retirement. So if any of this is confusing to you, my suggestion is you connect with us. We want to make sure that we clarify what the rules are now moving forward and that you understand what you need to do in order to make sure that you have group health insurance if it's important to you and your family when you retire from LPSS.
Ms. Trish, can you also
Yes.
add that is not
Eligible dependents, so keep in mind dependents can stay under our plan. When I say dependent, I'm referring to your spouse and your children. I mean your dependents to be under our plan and for you to have them on there when you leave the district and you retire with the district, then it will be important insurance on January 1st of 26. So that if you're not on it now and you're retiring within 5 years, you would need to enroll during the annual open enrollment that they are communicated to and that they take action if this is important to them, because it is now a requirement for our board policy. And with that board policy change, there is now a vesting life insurance. Same process. Employees hired prior to January 1st are grandfathered and eligible for post-retirement group life insurance benefits with continual district employment until retirement. Employees hired on or after January 1st are required to vest 5 consecutive years of employment immediately preceding retirement in order to be eligible for life insurance thereafter. So if you'll note below, I just tried to list the current options under the district paid life insurance actively working if they are under the age of 65. While they're actively working, ages 65 to 70, 7,500, at any point when they retire from the district, it automatically reduces to a $5,000 policy. So in order to be eligible in retirement for that $5,000 life insurance policy, they need to make sure that they adhere to the vesting criteria for life insurance too. And that is all that I have for you today. Do you have any questions?
Thank you, ma'am. All right. Before we adjourn, just a couple of announcements. Our October meeting, our meetings are typically scheduled for the first Wednesday of every month. We've had to make a couple of changes recently, and we're gonna also do so in October. We're scheduled on the books now to have a meeting on October 1st. However, we are going to push that meeting back. First, it's only 2 weeks from now, so it didn't make much sense. But most importantly, we want to make sure that we have enough time for the teams to get all the information together for what will be, I guess, a more impactful or a more detailed meeting in October. So I think we're looking at either the 15th or 20th. We're going to wait until Ms. Christie gets confirmation from all all the parties that need to be here. And as soon as we get that confirmed, we're gonna get it sent out to the public. Fellow committee members, well, and also superintendent, what we're gonna be seeing, you start seeing agenda items regarding the finance. So I'm gonna work with the committee to put together what we and the board and the public would like to see regarding finance on a monthly basis. I've heard from several folks since they've combined these committees that we don't hear anything on finance, and they're right, so we're gonna change that. And then superintendent, I know that I've spoken to some of your team about, well, and you have made it clear that we need to jump on the property and casualty. So we're gonna be jumping on that, maybe not in October, but soon after. So I know that these meetings have been rather kind of the same, but that's to be expected at this time of the year. And that all changes starting next month. So with that said, with no other items on the agenda, thank you all for being here, and this meeting is adjourned.